Hey, it's Dr. Darren Schmidt representing the Power Nutrition Practice Company. This is a training company that I set up with my top associate, Carrie Cradit. And I'm going to go over these test kits right here. These test kits were designed by me for the technique that I call follow the physiology. I made this graphic right here on the wall. We'll go over this a little bit. But the bottom line is in 2016, I had black mold poisoning. I didn't know that I had that cause, but I had these series of symptoms. And I started some supplements from the 1930s and started to get better. They didn't address the cause, but they were addressing the mechanism. I started reading these old books, textbooks, medical textbooks, and nutrition. And the doctors back then were trying to fix the mechanism of chronic disease. The most common mechanism is lactic acidosis. There's actually 18 other mechanisms, but lactic acidosis is by far the most common one. And now in modern times, it has different terms. In the past, people would call it sugar acidosis, or now people call it mitochondrial dysfunction. It could be alcohol fermentation, lactate fermentation, excess glycolysis. The whole point is if your mitochondria are producing ATP, then you're healthy. If the mitochondria are dysfunctional, now you're making ATP in the cell cytoplasm but not in the mitochondria, now you have chronic disease. That's what it comes down to. So I'm explaining this now because I have vials in here to explain or to test for that when you do the muscle testing procedure. So FTP stands for follow the physiology. We're tracing back abnormal physiological function. We're reverse engineering it to get the physiology back into shape and getting people well again. So we're not relying on, giving people supplements because their arm goes weak during a certain procedure. The practitioner, you need to be able to think with this process right here, whether you do muscle testing or not, whether you're, regarding the history taking or regarding lab work. You have to think in terms of these 3 steps. Find the cause, fix the mechanism, and then here we have symptoms that are caused by organ dysfunction, so you want to feed the organs. Now, most doctors just focus on the symptoms, the 3rd circle. And the good holistic doctors focus on the 1st circle and the last circle. And then the only people that I know of that work on the middle are people that I've taught. Now, a lot of people that use standard process or systemic formulas, they work on the middle circle, but they don't even know it because it's built into those products. So that's for another video. Now, these test kits then are called HFG III. And what that means is holofractal graphic, which is a term in physics that describes the field around the body. That's another video there. III stands for innate intelligence interaction. So the vial itself is designed with the energy of the field to enhance the reading between the vial and the patient's body. So it's an enhanced innate intelligence interaction between the practitioner and the patient using the vial. So the first kit really is this yellow one, and when you open it up, this first part has to do with the causes. The second part has to do with the mechanism, the most common mechanism. And then the other kit is red, and these are organs. So that has to do with this, and we're finding organs using these vials. Now there's been many times when I'm testing somebody's pain and it doesn't go weak. So if somebody says, yeah, I have shoulder pain, and then I touch their shoulder and their arm stays strong, and I'm grabbing it and I'm pushing multiple times, I'm irritating the shoulder. And what I was told in my early training was, well, the body's not yet ready to heal the shoulder. And I'm thinking to myself, but the patient wants it healed. And who writes the check, to the office? Is it the body or is it the patient? So you better find that pain. You better do something to make that arm go weak so then you can address it. So that's where these vials come into play. Here's a vial for joints. Now I put HFG in front of every single word describing these vials, so you can hold this up there and then the arm should go weak. But if it doesn't, then you can grab this one. This is HFG ligaments and tendons, and maybe that'll go weak. And if that doesn't go weak, Then you grab bones, grab muscle, grab nervous system, and connective tissue. So there's overlap. Now you can have, let's say somebody's shoulder pain is both ligaments and muscle. So those two vials will show up, but not the nerves, not the bone. Now you know where to direct your testing when you're trying to find a solution. Another way that you can use these vials is by figuring out like what organs are harming other organs. So I have a patient with he had some digestive issues, some constipation, and some pain here, and also headaches here. And when I did the testing, I went through these organ vials, and I found the spleen vial was weak at the stomach. So his spleen was affecting his stomach. And the supplement that he tested for was by standard process called prosymbiotic. And I told him to open up the capsule and let the powder get on his tongue. And then maybe it'll, once that powder hits his stomach, he'll have better results as opposed to having the capsule open up in his stomach. So he's opening up and then swallowing the powder. And then I saw him a month later, and his intestines and his stomach were much better, and his headache was gone. So, but I found that because I used the spleen vial sort of scanning around, and the spleen was affecting his stomach, and that's how I found the need for this prosymbiotic supplement. So those are a few different ways to test using these vials, but let's go through what these vials actually mean and why I put them in here as they are. So with these first 6 vials, from this category, the causes, we have 6 what I call pre-organisms. And they're based off this book called The Curse of Louis Pasteur by Nancy Appleton. And in this book, she talks about the original founders of these pre-organisms, and there was multiple people, and they all had one thing in common, and that's their expertise in optics, and they made microscopes. So we have Wilhelm Reich. He found these little organisms, and he called them bions. Antoine Béchamp called them microzymas. Walter Cannon called them cells that could go dormant. Gaston Naessens called them somatids. Gunther Enderlein called them endobiots. Royal Rife called them turquoise bodies or pinpoint cells. And other words in here are cryptocytes primordialis and progenitor cryptocytes. So those are just a bunch of people that found these organisms, and I made 6 vials to represent them. So the first one's called post-cryptocytes primordialis, and then cryptocytes primordialis, and then progenitor cryptocytes, stealth morph, and microzyma, and macrobes. So now these organisms are really ignored in conventional healthcare, and there's another term that people use is called nanobacteria. So all these names I just put together and described to you, just think of them as small things, small organisms that may or may not be alive, but they move and they replicate. And it's debatable whether or not, they're even alive. But they're teeny tiny small, so that's why their modern name is nanobacteria. And they can morph and change into other things, and they can go dormant and rest for a long period of time and then later thrive. So really what matters is the health of the body. When the body's healthy, then these organisms have a hard time living or replicating, I should say, and they can be dormant forever. So the next 2 vials are bacteria 1 and 2, and then we have fungus 1 and 2, virus 1 and 2. So these are standard homeopathic representations of bacteria, fungus, virus. And I got these vials from alhvials.com, and he specializes in making these vials. He makes all the vials for all the muscle testing techniques. And he has a standard set of organisms under bacteria, under virus, under fungus. So it's just a standard set. But what makes these special is the HFG part, the physics. I put the physics of the universe, of the fields, into these vials. And I made a whole test kit. These are all physics vials. I have like vacuum field, golden ratio, fractal, event, implosion, space-time fabric, spheres, ratios 1 to 1.618, 19.47 equator. All these things are from a course that I took from the guy that unified physics. There's this thing called the unified theory, and nobody could figure this out for 100 years, including Albert Einstein, but Nassim Haramein figured this out. So I took an online course from Nassim Haramein, and I learned all this stuff about physics and the unified theory and the description of the field around our bodies. It's the same field around dogs and plants and animals and planets and electrons. So it's infinitely small to infinitely large, but its characteristics are all the same. So I put those characteristics in here. So now continuing on, we have 4 more vials that are related to organisms: parasites, parasite egg layers, and then we have parasite eggs 1 and parasite eggs 2. So parasite eggs 2 is up here. So you can get rid of a tapeworm out of a person's body, but what about the eggs? Tapeworms lay 30,000 eggs a day. So sometimes the eggs show up and you got to get rid of that too. And next we have some chemicals, 56 chemicals in 1 vial, 23 heavy metals in 1 vial. The next 3 vials are still related to detoxification. They are phase 1, phase 2, and phase 3 detox pathways. And then we have drainage. So drainage is different than detox. Detox is where you're grabbing toxins and pulling them out. Drainage means that the liver, kidneys, sinuses, lungs, they're all open to cleaning. Like mucus can leave the body. So you want to open the channels for drainage. And then we have 2 genetic SNPs. Now there's 1.5 million genetic SNPs that have been discovered. These are problems that genes occur, some sort of a break in the gene itself, the gene sequencing. Out of 1.5 million, we know how to fix 2 of them. MTHF is one of them, and then NRF2 ARE. So the solution for MTHF is a methylated B vitamin, and there's a lot on the market. And the solution for NRF2 ARE is these complex herbs like echinacea, rhodiola, ginseng. They have a lot of vitality in them, a lot of life in these herbs, and a collection of those can fix this vial. Next we have in the cell high cell glucose, and the next one is high cell mercury inside the cell. And then dysbiosis, which is unfriendly and unbalanced bacteria and fungus in the body. And lastly, on the side we have EMF and RF interference fields. That's electromagnetic frequencies and radio frequency interference fields. You can test for supplements for that, like garlic, for example, or cayenne pepper even, but I usually use safespaceprotection.com. I like their products to deal with these EMFs. The other side of this test kit is the mechanisms. So lactic acidosis, we have HFG lactate, acetate, acetaldehyde, and ethanol. Those are the 4 waste products from burning sugar, from glycolysis. There's also lactic acid, and then acid, and then uric acid, carbon dioxide, and methane. Those last 3 are actually waste products of black mold, toxic mold, and they're all related in that it's poisonous, it's either an acid or it acts like an acid, it increases blood flow, or it stagnates blood flow. Either one of those, hyperemia or congestion of blood flow, prevents nutrition to get into the cells, and it also prevents cells from dumping their waste into the blood. That's lactic acidosis. That's another video. And then down here we have alkalosis, which is another minor mechanism, and the solution for that is phosphorus, for example, fast food from standard process. And then the last 2 on this row are low barometric and high barometric pressure. So if somebody feels arthritis before a storm, I used to take them outside and test them outside, but that didn't always work because the weather didn't always cooperate. Plus we had to walk down the hallway and leave the building. So I made these so you can test people who are affected by weather changes, humidity, etc. Now over here we have plant poisons. I don't have food allergies in my test kits. And the main reason why is because Dr. Royal Lee, the father of holistic nutrition, said that food allergies are lactic acidosis. But I did put poisons in here. We got lectins, nightshades, oxalates, phytates, salicylates, and then seed oils. Seed oils is the new term for vegetable oils. So all of these are damaging, not always though, depending on the person, so you can test for these chemicals. Now the chemicals are made by plants in order to defend themselves from being eaten. Animals will kick you or bite you or run away, or animals will have venom, for example, like a snake or a scorpion, and that's how they defend themselves. Whereas plants, they can't run away, they can't bite or kick, they make their own poison, and so they punish you for eating them. So there's many poisons in wheat or nightshades that people can be affected by. So there you go. There's the introduction to this test kit. Now the second test kit, the last one, I'm going to run through these organs, and I'll make some comments on some of them, but these are in alphabetical order. So you have adrenals, appendix. With other testing techniques, it's hard to find the appendix because it's so small, but you can pull this out and put it right where you think the appendix might be. It tests around the area and try to find it. Okay, arteries, red cells and white cells. This says blood, red and white. Bone marrow, bones and teeth. I put bones and teeth together. Brain, breast, cerebellum, cerebral spinal fluid, connective tissue, cytoplasm, ducts. Ducts could be breast, like milk ducts, or liver ducts, gall ducts, gallbladder ducts, ducts that lead enzymes from the pancreas into the small intestine. Epithelial tissue, that'd be skin or different layers of skin. Eyes, fat, fingernails, frontal lobe. Fat would be the fat cells because they could be toxic. Gallbladder, hair follicles for people losing their hair. Heart, hypothalamus. I find heart a lot. It would be like over here on the side. Hypothalamus and inner ear. I have people put this, I hold it to their ear, they hold it to their ear. Joints, kidneys, large intestine, ligaments and tendons. So I've just listed off a bunch of vials that could pertain to, like, the knee. Ligaments and tendons, joints, epithelial tissue. Okay, now we have next. So we got kidneys, large intestine, ligaments, okay, liver, lungs, lymphatic system. I find this a lot here under the armpit, or it could be under here, mostly under the armpit. Membranes, that could be cell membranes, other types of membranes. Mitochondria, you want to make sure they're functioning well, but some of these vials are inside the cells. Muscle, nervous system, ovaries, pancreas, parathyroid, parotid, pineal, pituitary, pleura, that could be around the lungs, prostate, sigmoid and rectum, so last part of the large intestine, salivary glands, and scar. Could be internal scar, could be external scar. Okay, I'm going to back up a little bit because I mentioned nervous system. So we have nervous system, brain, frontal lobe, cerebellum, that's eyes, any nervous system related organ from here up. And then down here we have temporal lobe. I'll get to that in a second. But so, okay, we got sinus. Now this could be anywhere, right? In here, it's not just this reflex or this reflex. You can scan around. Small intestine, spinal column, spinal cord, spinal discs, spleen, stomach. There's temporal lobe on the side. Testicles, thymus, thyroid, ureters. Ureters go from the kidneys around to the bladder in the front. So people have a stone leaving their kidneys getting into their bladder. Their ureters could be inflamed. Urinary bladder, uterus, and veins. So I have veins at the bottom, arteries are alphabetically at the top. So in the circulatory system, you want to test veins and arteries and the heart. All right, and arteries are muscular, so it could be more of the muscle vial. Anyways, here's where creativity comes into play and knowledge. You're not just a technician doing the same technique over and over again to the same people, or to different patients throughout the day. This is where you have to think and apply your knowledge on how our bodies break down from chronic disease. And you got to find the causes, mechanisms, and symptoms, or feed the organs to get rid of symptoms. We have this poster available for purchase at $25. That includes shipping, handling, postage. So you can get this for your office, frame it, put it on the wall, and it'll help you guide your way through a patient's care. Now, in my trainings, in my seminars, I talk about really good, easy to use detox programs that are very effective. It's an adventure, and it takes many months or even years for people to get lead out of the bones, to get mercury out of the brain. This is not a short-term thing. You don't put somebody on a detox program 1 month and then the next month you take them off. That doesn't make any logical sense whatsoever. And now when it comes to parasites, we're talking 3 months, but I've had people poop out parasites for 2 years. So you got to be in charge, and as opposed to letting the muscle testing direct you, you're directing the care, and you're using muscle testing as a tool. Muscle testing doesn't not direct you. You direct it, because you have a finite number of things that could be wrong. We have 3 main causes. We have 1 main mechanism, and then we have 6 ways to feed the organs. So when you're looking for causes and none of those 3 come up, don't waste another half hour trying to find a cause, because these are the only ones that are there. And then you move on to the next one. And throughout the course of a series of visits, or maybe even in one visit, you're finding all 3 of these. So there's my intro for these test kits. These are for sale at $400 for the pair. And you can buy them and not ever come to any of my seminars or study any videos. I encourage you to use these and learn and come to the seminars and watch the videos so you know how to use these properly. Now, I never intended ever in my career to make my own technique, but it was thrown at me when I read the 1930s books from the founders of medicine. They told me how to do it, and all that information was forgotten, especially the mechanism. Nobody talked about this post 1967. And I even called up some of the earlier nutrition lecturers, and I asked them, "Do you know about this?" And they said, "No, I didn't." They didn't know about. We're talking in the 1970s and 80s. They never talked about this. So I'm bringing it back, and it just makes life so much easier in a nutrition practice when you address all 3. I remember having a patient with hot flashes. I was feeding her kidneys, and I can't remember what I did here. She had a cause, and she got better, but then she plateaued. In one visit, she's still suffering from hot flashes, and then I gave her the right supplement for the mechanism, and that was the linchpin that fixed it, basically permanently. And she was very happy about that. But without this knowledge, I would not have been able to help her. So I encourage you to buy this, and I encourage you to make sure you're on our email list, and you can come to our seminars and watch our videos, and when we have online training.